And we begin here at 4:30 with a look at one group's unexpected role in the fatal bus crash last week in Pembroke.
Journeys End Refugee Services provided a crucial service that allowed crash victims and first responders to communicate. Right now, we are joined by the organization's CEO, Pamela Keffey. Pam, thank you so much for coming in this afternoon.
Thank you for having me.
So first, let's begin with maybe walk us through what Journeys End's response looked like on Friday.
Initially, we were reached out to by the local hospitals. We've been doing interpreting services in the area for many years, and we often provide interpreters to emergency rooms or surgical units, various healthcare organizations. So it was natural that they would reach out to us. And we did our best to provide interpreters for a variety of different locations, from ECMC and Kaleida locations. But then we quickly got in touch with the Red Cross and learned about their response center that they were setting up. And we worked to provide interpreters actually initially around the clock because nobody really knew what to expect. And they wanted to make sure that there was coverage for everybody as they were being discharged from the hospital into the Red Cross program.
How crucial were those interpretation services? Because from what we understand from state police, very few, if anyone, on the bus spoke English and spoke it fluently.
There were a variety of different language needs. There were definitely some people on the bus who did speak English. But there were many people who did not, and so we needed to focus on Cantonese and Mandarin. We were asked to provide Hindi interpreters, but we found we needed Tamil also. So we had to reach out to the community for additional support. We don't have that many people on our roster to cover around the clock for the weekend. So we reached out to the Chinese American community, and they came through for us in incredible ways. Other members of the Amherst town government reached out to the Hindi community, and people just came out with all kinds of support. So it wasn't just language that I think was offered that day, it was also community connections and cultural support that people needed.
It's all about that collaboration, right?
Absolutely.
Pam, if you can, for anyone who may be unfamiliar with Journeys End, you offer a number of resources. Run through a little bit of your mission and the resources you provide.
Our mission essentially is to support the immigrant and refugee communities here in Western New York. We are really well known for our refugee resettlement program over the years, but this year that's been put on pause because of federal changes. But we continue to provide immigration legal assistance in Buffalo, Rochester, Ithaca, and Binghamton. And we have a variety of case management services here in Buffalo and in Jamestown. We help people find jobs. We do youth mentoring and academic tutoring in the Buffalo Public Schools. We have an urban farm that is thriving at this moment, and we have an interpreting and translation department that provides languages, about over 60 languages. We have 130 interpreters on our roster, and we work in schools, hospitals, courts, you name it, we're there.
On the 90 crash, take us inside sort of that scenario. Once the interpreters are contacted, and you had mentioned about there were numerous languages that you needed to have on site there. Once they were able to get on site, what was happening then to try to communicate with the victims?
So I just want to be clear that we were not at the crash site or the accident site. We were actually at the Amherst Senior Center. And then we moved with the response center when it moved over to a local hotel. And so we were waiting for people to be discharged from the hospital. And they were brought over to the Amherst Senior Center by other community volunteer groups, where they met with Red Cross volunteers and learned about what resources would be available to them. So our interpreters sat at the table with the volunteers and with the individuals. There were also times where I noticed our volunteers, our interpreters, or I'll say language facilitators, because many of them had never been trained as interpreters, but they were beautifully, bilingual. I saw them reaching out and asking if people needed any help, and they were starting to identify some other needs that people had. And as community supporters, they started to help, just provide some kind of guidance around what resources might be available. And then they acted as a liaison back to the Red Cross about what people needed.
Wow.
Well, certainly such an important resource, not just, for this one incident, but really as a whole for our community. So thank you, Pam, for, what your organization is doing, and thank you for joining us.
Thank you for having this conversation with us.
Of course, thank you.